Hello and welcome to the health program on Trust Television. I am Aisha, Salihu. On this week's episode of the program, we'll take a look at the prevalence of chronic kidney disease, end-stage renal disease, and its management strategies. Prevalence of CKD documented in developing and developed countries range from 2.5% to as high as 35.8% in the elderly population. Even the young population are taking the lead now, with a number of risk factors exposing them to the scourge. There has been reports and evidence show that the cost of managing end-stage renal disease or CKD has increased significantly, making it difficult for a lot of patients to access the much-needed care. Joining me on the program to share more insights on the subject and discuss the way forward are Dr. Ekwenna, who is an Associate Professor of Urology and Kidney Transplantation, and also Dr. Wada Ibrahim of Nisa Premier Hospital. Thank you so much, doctors, for joining us on the program.
Thank you.
Thank you.
Now, we're familiar with the functionality of this organ. The kidney removes waste and extra fluid from our bodies. Kidneys also remove acid that is produced by the cells of our body and maintain a healthy balance of water, salts, and minerals, such as sodium, calcium, phosphorus, and potassium in our blood. But when it is unable to do this, we can therefore detect a fault. Now, I'd like to hear from you. Let us briefly look at, say, the causes and risk factors. Let me start from you, Dr. Ekwenna.
So in terms of, again, thanks for having us here. Thank you for the invitation to talk about kidney disease. As you rightfully said, the prevalence of kidney disease around the world is steadily increasing, and particularly now in young people. The most common cause of kidney failure or kidney disease, say, is high blood pressure or hypertension. In Nigeria, in the United States, the most common cause of kidney disease is diabetes. And you know, I would say in Nigeria it's probably hypertension than diabetes. In the United States is diabetes and high blood pressure. Those two are far and wide the most common causes. There are some other infectious etiologies or infectious causes of kidney disease. There are some, I'll say, congenital things that can lead to kidney disease. Genetic predisposition can lead to kidney disease, but those are sort of few and far between. I mean, you know, less prevalent. Kidney stones, for example, can lead to kidney disease. Utilization of chemicals that are dangerous. For example, I know in Nigeria, people have talked about sort of skin lightening creams and things like that. There are environmental exposures that can lead to kidney disease, but far and wide, the most common causes are hypertension and diabetes.
Now, one would want to ask, how does hypertension and diabetes cause kidney disease? I mean, how can you make it make sense? High blood pressure and diabetes?
Well, you know, I would say, so high blood pressure, how does that cause kidney disease? Well, you know, one of the things about high blood pressure is that a lot of individuals don't know they have high blood pressure. So if you know, I will say if high blood pressure is detected early and controlled with medications, typically, you know, patients can do well and preserve their kidney function. You know, I won't get into too much of the details of the nitty-gritty of the physiology, but essentially, you know, high blood pressure decreases the flow of blood to the kidney eventually. And so it causes a cascade that hurts the kidney and hurts the heart. You know, so the heart, the kidney get hurt by high blood pressure. The high blood pressure also hurts the brain, right? And one can have a stroke, which in turn can hurt the kidney. So all these things, the cardiovascular system is basically impaired by high blood pressure. Diabetes, on the other hand, hurts the functionality of the kidney in filtering the normal things. So when the sugars are very, very high in the blood, they can attack certain cells or the nephrons of the kidney, and that causes the kidney to start losing protein. And so when you can't regulate protein or filter out protein, that can cause now the patients to lose their kidney function. So again, if diabetes is detected early and managed well, then you can preserve the kidney function. So those two things, prevention is very important, right? So if you can, manage those two diseases well in the beginning, one can preserve their kidney function. So.
Okay, let me come to Dr. Wada at this moment. I'd like to hear your thoughts on infections causing inflammation in the kidney.
Thank you very much. I have to start by appreciating you people getting us here to enlighten the public about this very important topic. And I'm very pleased to share this podium with the expert, Dr. Obi from Ohio, and to also declare that my region of interest is not exactly kidney itself, but I do know what infections can migrate into the kidney and cause damage. You may have heard of urinary tract infections, and you get this from your bloodstream, you get this from contamination locally there, and women more than men have this. You can get this after surgical interventions of all sorts. And here again is when you have not detected the infection early. So the bloodstream infection, like they call it glomerulonephritis, it actually is within the kidney causing damage. And if it's not detected early, it can lead to the kind of protein loss, inability of the kidney to filter properly and retain what you need and allow what you don't need to go out of your body. And the decline then happens and you end up with long-term kidney disease. So there are, in ranking, it's been clearly defined to us that, you have high blood pressure, which reduces blood supply to many organs in the body, including the kidney itself. You have diabetes, which is a long-term disease that, high sugar level, and if it's not detected, it's also associated with blood vessel disease, and all sorts of damage can occur to the kidney. So it's important to say this glomerulonephritis, even common in children. And maybe people do not know, and the kids recover and they're living their normal life, but kidney failure is waiting when they become more, like adults. So I think it's just to polish that, you can get a bug in your kidney if it's not known, detected, and attacked early to get out of your system. You then lose out in terms of kidney function ultimately.
Thank you so much, Dr. Wada. Now, let me come back to Dr. Uche. An alarm was raised in 2019 about 2 new causes of kidney disease in Nigeria. I know you talked about it earlier. These causes were identified as toxicity caused by prolonged consumption of traditional herbal concoction and exposure to harmful chemicals due to use of skin bleaching cream. Now, my point here and my question here is that we have seen these traditional medical practitioners advocating for the use of herbs, traditional medicines instead of the orthodox drugs. At what point do you think we can draw the line? Say, when you consume these too much without proper dosage and administration, it can harm your kidney. I just want to hear your thoughts on it.
That's a great point. These chemicals, chemicals are dangerous. Some of them we cannot measure exactly what's in these concoctions. And I know from literature, just from reading, that some kidney disease have been linked to the exposure to, there's traditional drinks or, herbs, or the skin bleaching creams. And some of these, at least for the skin bleaching creams, we know that they have mercury. And so, mercury can be toxic to the kidney. And, there are certain metals that can, that are, in these, bleaching creams that are harmful to the kidney. And so when you use very, very high levels of these bleaching cream, then they're bound to hurt the kidney. So that's what we know, and we have been. I think that the enlightenment of the public is to say, hey, look, stay away from these things. These are dangerous. They can hurt you.
But then what is your advice on the usage of these traditional medicines and herbs?
Well, again, I wouldn't say that I'm an expert in that area, right? I know what I know. I think if you don't know what it is that you're consuming, right, it's probably better not to take it, right? So, food is medicine. The things that we take into our bodies they can nourish our bodies, but they can also hurt us. And so if you don't know what it is that you're bringing in, then I would say avoid it.
I want to hear from you. We have talked about the population affected by this chronic kidney disease or end-stage renal disease. I'd like to hear your thoughts. Why do you think we have more young people coming up with kidney diseases these days?
That's that's the elephant in the room, so to speak, right? In this population, in the African population or West African population, and also in North America, we have Black folks, who are predominantly affected by kidney disease because of high blood pressure. Okay, so that's one disease that affects our population. There has been some genetic predisposition to kidney disease that has been identified, particularly in patients of African descent. And so there's been some genes that have been identified, and we think that maybe that's what's causing some of this. Undiagnosed high blood pressure is also has been identified in this population. So I think those are the key things that I would say have put that population at risk for kidney disease.
Okay. Now, I'll come back to hear your thoughts, the two doctors we have with us in the studio. Now, let's go and launch a report at the moment where health experts have again reiterated the need to address chronic kidney disease through early detection, intervention, and preventive measures as it has become more prevalent among young people. The call came on the heels of the introduction of 60 dialysis machines at a private medical center in the nation's capital, Abuja. The machines, experts say, will help increase the number of available machines and reduce downtime and machine breakdown recorded at public hospitals for patients seeking renal disease management through dialysis and kidney transplant procedures. Let's take a look.
End-stage renal disease, although a global disease, is however more burdensome in low and middle-income countries. According to data, it accounts for 8% of all medical admissions and 42% of renal admissions in Nigeria. Experts in the sector attribute the leading causes of kidney disease to high blood pressure, diabetes, obstructive uropathy, HIV, and kidney inflammation from a variety of infections. ESRD may be irreversible, but experts admit with early detection and routine medical checks, it can be managed.
And there are some things that are peculiar about kidney disease in Nigeria. One, it affects the younger people who are in their economically productive age group, between the age of 30 and 50. Unlike in the developed countries where it is a disease of the elderly. Currently, dialysis one session costs between 50,000 and 70,000, depending on where you are doing it. How many of us can afford that? And you need to do it 3 times a week. Kidney transplantation costs between 18 million and 23 million.
Part of what I've started to do myself is to sponsor a motion that all FMCs in Nigeria must be of high standard. We should be able to have a semblance of facilities that we have in India or in UK or elsewhere. It doesn't cost an arm and a leg.
The government has looked into this situation and it has noticed that there is a heightened rise of number of kidney diseases all around the country. So processes are on the way. There are discussions as to how to leverage against what is actually existing now, and then how to improve on what's available to improve on the access of care.
While patients decried the cost of managing the disease, experts are advocating partnerships with all health institutions to clamp down on the disease burden.
You see how the way they subsidize HIV drugs and all, yes, I think they should do the same thing too for both dialysis patients and people that have done transplants, because if you do your transplant, the drugs are really expensive, and sometimes you save up money, 23 million naira to do your transplants. At the end, you still live on drugs till you die, and the drugs are not cheap.
What government can do is to shore up and support dialysis patients and say, okay, look, you know, for each dialysis, rather than pay 50,000 naira, you pay, you know, 30,000 or 20,000 naira. That is the only way to help in the interim. Ultimately, we produce our own consumables, we do our own surgeries, we'll hopefully produce even our own dialysis machines, and then we're free and go.
With the growing trend of kidney disease severity moving to 8th position in 2019, ahead of malaria and HIV, with projections that by the year 2040, it will become the leading cause of death all over the world. Stakeholders say more needs to be done to arrest it.
Welcome back, and thank you so much for staying with us. We'll still have Dr. Obi Ekwenna, Associate Professor of Urology and Kidney Transplantation, and also Dr. Wada Ibrahim of Nisa Premier Hospital with us in the studio talking about the management of chronic kidney disease. And this brings me to the conversation proper for the management of chronic kidney disease. I'd like to hear from you, Dr. Obi. We talked about introduction of dialysis machines to add up to the number of dialysis machines we already have in the country. Now, I'd like to hear from you. What's your take on the collaboration between private hospitals and government hospitals, or also the government in general, on dialysis and transplantation?
Thank you for that question. Yeah, so, I mean, it's good news to hear that there has been more dialysis machines introduced to help patients who are suffering from end-stage kidney disease. You know, as you know, patients who have the diagnosis of kidney failure require dialysis to live, and so you know, the mortality or the of patients who have the diagnosis is almost 90% at 3 months. So if you have 100 people that start dialysis today and you follow them for 3 months in Nigeria, about 9 out of 10 of them will be gone. And so that's a very high mortality. The reason for this is not only because of the burden of the disease on the body, but primarily because of the cost of dialysis. So the cost of dialysis is quite a bit. And you know, when there's no insurance scheme to help some of these patients with the cost implications, a lot of patients have to pay out of pocket, and so you know, we know that's exorbitant, and so the assistance of government is critical to save these patients. And as you mentioned earlier, the patients that have this ailment are usually the younger patients. These are the most productive age group, so to speak, in the population. And so I think there's the role for the government to play. There's a role for private hospitals to play. And their non-governmental organizations also can play a role in helping work to help these patients that are there in their need. Okay. So it's a good news that dialysis is available, but dialysis is a bridge to getting the standard of care for patients who have kidney failure, which is kidney transplant. Okay,
let me come to Dr. Wada at this moment. Dr. Obi talked about patients having to pay out of pocket because sometimes to access the care for this kidney disease is usually very exorbitant and expensive. Now, I'd like to hear your thoughts. What do you think government can do to ensure that there is NHIS coverage for kidney disease?
Thank you very much. I'm a believer in health insurance because I do know for sure that even in the advanced climes like USA, where Dr. Obi comes from, not many people can dip their hands in their pockets and pay for anything medical. So insurance is the way. Those who are healthy keep contributing to a pool of funds. Those funds go to treat those in the population who are ill, like needing kidney transplant or others. I think our NHIS should be the backbone of healthcare in Nigeria. It is in any other country, it is seen as the foundation. You see, when you need more, probably more psychedelic accommodation and special specialists, that's when you are required to maybe top up your NHIS so you can access a high level of care. So the question now is, we've been at it since maybe more than 20 years now. How far have we gone? You see, it's still a convenience of those who are in the formal sector of employment, especially government formal sector. But there needs to be a big growth. So there's community-wide insurance, there is workplace insurance, there is school insurance, there's maternity insurance.
Yeah.
Once you guard the human being with easy access to healthcare, things don't get too delayed before they are detected, whether it's hypertension, diabetes, whether it's infections. Then you can even have a chunk of people who are needing dialysis come off. You know, not many of them will get to that very bad level. So I am an advocate of countrywide health insurance, whether it be states, whether it be local government, whether it be federal government. It's not like, I don't think we have a choice if we are to account for every individual who is a citizen of the country. Enough effort, enough funding. Don't forget that the people pay out of their salaries or earnings into a pool of funds. Government gives subvention to that to make it more. What a better way to go. So people who need healthcare don't have to check their pocket first before they go to the next hospital. What can be done is multifactorial, as I've said, whether, you know, from neonatal care, pregnancy care, school age care, workplace care, all of this can add up and provide us a big platform of health insurance sooner than later.
Thank you so much, Dr. Wada, for your thoughts on the NHIS coverage for kidney disease. Now, lastly, my question to you, Dr. Obi. The Transplant Association of Nigeria and the federal government plans to draft guidelines on organ transplantation to ensure that ethical practices are maintained in the sector. Now, we know that 15 centers where transplants take place in Nigeria are currently active. We have 15 centers where transplants take place in Nigeria. However, few are currently active and mostly owned by private sector, and they also have their challenges. I'd like to hear your thoughts on the draft for guidelines on the unethical practices of organ transplantation.
Thank you again for that question. It's a heavy question, but I would say I'll start by saying that a few days ago, NISA, Premier Hospital and the medical group with Dr. Wada's leadership, an organization that I'm part of, Clarion Call Care Foundation, the Transplant Association of Nigeria, partnered to put together what we call the Living Donor Day, which was an event that sort of recognized people who donated their kidney in Nigeria. We had another gentleman who came in from the US, and the idea was just to recognize people who have actually donated and thank them for their compassion for what they've done in helping save a life in Nigeria. And these people donated their kidney in the right way, right? In an ethical fashion within hospital system, not just at NISA. These are people that donated everywhere around the country. So we had about 10 to 11 people, actually 11 donors who came forward to be recognized. So I point that out because Transplant Association of Nigeria was represented by the vice president of the association and the Minister of Health, the minister who's Dr. Ali Pate, was represented by, was also represented. And they both had significant statements that were made at this meeting. And I will say that the Transplant Association of Nigeria, working with the federal government, I'm happy to hear, I heard, Dr. Wada can also testify that he heard that they have they have a draft of guidelines that will help the quotes sanitize transplantation in Nigeria to sort of begin to meet all the world standards as far as ethical practice goes. And so I was happy to hear that from the minister's remarks and also from the president of Transplant Association of Nigeria. So that's a great step towards standardizing transplantation, because it's an essential part, getting an organ for patients who have end organ disease. Remember that it's not just kidneys that fail, livers fail, the pancreas fails. Nigeria is a little bit far behind, to be frank with you, in terms of what is available in other resource-constrained environments. Because yes, Nigeria is resource-constrained, but we're not helping some of our patients, some of the people that actually need this. We're not helping a lot of patients that have kidney failure. We're not helping patients that have liver failure. We're not helping patients that may need a pancreas transplant or the organs. Sickle cell is prevalent. We don't do enough bone marrow transplant. So transplantation, I think we don't want to get left behind, right? We're talking about xenotransplantation around the world. People are talking about that. We don't want to get left behind. So,
all right, then I'm afraid I may have to cut you short there. Let's hear your final thoughts, Dr. Wada, just before we go.
I think that high-end medicine is very much required in this country, like the transplantation that we're talking about. I think we have a problem in even getting people to understand, and that's why the Living Donor Day was a very important day in the calendar of health in this country, graced by the minister's representative and the president or vice president of Transplant Association, worthy of people like Dr. Obi at their own effort and cost, coming all over with his colleagues from the United States to show us that this is a doable thing and we need to wake up and get going.
Thank you so much for your thoughts and insights on the particular subject of discuss. We have been speaking with Dr. Obi Ekwenna, who is an associate professor of urology and kidney transplantation, and also Dr. Wada Ibrahim of Nisa Premier Hospital. Thank you so much for joining us on the program.
Thank you.
That concludes this week's episode of the program, Healthy Living on Trust Television. For comments, contributions, and suggestions, do well to follow and subscribe to all Trust TV social media handles. Download the Trust TV app on iOS and Android devices across their respective stores, and get live updates on the YouTube live stream and the website. Join us next time as we continue to explore subjects crucial to your health and well-being. I am Aisha Salihu. Thanks for your time.